government's inaction that is forcing First Nations families to make heartbreaking decisions. Decisions on whether to reuse feeding tubes and syringes and risk an infection or be safe, but watch their children go hungry waiting for these tubes to arrive. The health minister said he would make sure that no child had to wait for medical care, while Ottawa and the province has argued over the bill. But the Trout family in Cross Lake can't wait any longer. As thousands of people march today across Canada on this day of action, when can we expect this government to actually put First Nations children first so that they enjoy the same benefits as other Canadian children?
The Honourable Minister of Health.
Mr. Speaker, of course, we believe in a child-first policy. We believe that we have to make sure that children on reserve get the health services that they need, and if the honourable member has a particular case where that isn't taking place, then of course we'll take a look at that, Mr. Speaker. But we also call upon the provinces and territories to work with us to sort out these things before they reach a crisis level. That's their obligation, and we'd be happy to work with them.
The honourable member for Timmins-James Bay.
Thank you, Mr. Speaker. Well, this morning the Minister of Indian Affairs told 13-year-old children from Attawapiskat that building a school for them wasn't a priority because he simply had money, didn't have the money. Now the children have just gone out to the national media and said that they don't believe him. I'd like to ask this minister a simple question. Would he tell the Canadian public the truth, that unlike his predecessors who built schools, that he has taken the money from the education budgets for allocations for developing schools and spent the money elsewhere? And would he be at least honest with the Canadian public and tell them that the children of Attawapiskat, like so many other Aboriginal children, simply aren't a priority for him?
The Honourable Minister of Indian Affairs and Northern Development.
Well, Mr. Speaker, of course, I won't say that. I do find this particular member has a certain way, Mr. Speaker, of expressing himself. I met with the students, Mr. Speaker. They're very respectful, of course, and they plead a very strong case, Mr. Speaker, that they want to see a new school. And of course, I understand that. But, Mr. Speaker, we prioritize our spending based, first of all, on health and safety factors. Mr. Speaker, in the entire country, we rate priorities of school based on health and safety. I have set up a working group with the members, the Chief and Council, and others, other community members in Attawapiskat. Those meetings have taken place. There will be more meetings taking place within a couple of weeks, Mr. Speaker. And of course, we're working towards solutions.